Okay, please tell me your name and...
Holly Matza.
All right, tell me about where you are now. We just took your braces off, upper braces off today.
Right.
And then we are preparing to do full mouth reconstruction on you in a few weeks. And tell me your story. How long have you had the jaw, neck type of issues?
The jaw issues, or TMJ issues, I think started around about 10 years ago. And they were pretty bad for a while. Started to get better with a bite guard that helped with my grinding at night, and seemed to get better with time. And although maybe a few years later, after that, I started noticing some popping and grinding, and my jaw feeling like it got kind of locked and that sort of thing. That would kind of come and go, and then the latest, the most severe problem of all is it started about 4 years ago with a lot of cervical disc problems, neck problems,
And what was done
and
for
shoulder
it?
problems. I'm sorry?
And shoulder problems.
Yeah,
And what was done for it?
For that, physical therapy.
And
some
your husband?
Yeah, my husband is a physical therapist, and did a lot of traction, which would relieve the symptoms, but they would just continue to come back. Anything I would do with my upper extremities would aggravate it. Holding my babies, cleaning, reaching for things would set off all my symptoms.
And what's your profession?
Occupational
You're an occupational therapist,
yeah.
and your husband is a physical therapist.
Right,
okay.
right. And so so I was getting treated for PT for a long time, doing exercises. We'd go through periods where it would get better, but it continued to, it just continued to cause problems.
In the longer time period, in general, was the trend getting better? Or getting worse over a period of time?
No, I would say it was definitely worse at times, but I'd say overall the trend was getting worse. Because it was getting to the point where we were like, trying to figure out what else we were going to do.
Didn't you also get some neck injections?
Yeah, I had some cortisone, some
Epidural
cortisone injections.
In the neck?
How
many times?
2. Didn't do anything, didn't help at all. And so along with the neck and shoulder problems, then I started to have my TMJ problems started coming back as well.
When you say TMJ problem, you meant the jaw joint popping?
The jaw, yeah, like I'd feel really tight and felt like I was grinding my teeth at night. It was really tight and, had pain and that sort of thing. And so that's what initially made my husband think of you coming to see you. And then we were hoping that maybe there was some connection with the neck and the shoulder issues too, which we then found with all the testing and the x-rays and scans that you did, that you were able to show us that there was definitely that my cervical spine and disc was being compromised by my bite.
And what do you have in your mouth?
Right now?
You have an orthotic on the bottom.
Oh yeah, an orthotic.
You've forgotten that you even have it. You have an orthotic on the bottom.
We were just looking at the date on that. So it's been 1 year, and I would say once that was placed to reposition, correct my bite, within weeks I was noticing improvement.
Improvement in
my pain and
the neck pain.
My neck pain, my shoulder pain.
Which was your primary concern?
That was the primary concern, yeah.
Okay.
And within a month or two, it was just huge difference. So we just knew that was helping, because compared to over the last, at that point, it would have been 3 years that I'd been having it. All the pain that it was just such an immediate relief for me.
Then we did braces on the upper jaw. That's why you have spaces on your teeth.
Right.
And made the upper jaw the proper shape. And then we're getting ready to do the porcelain. That was your option. Do it that way, because we could have done that on braces alone. Take longer.
Right.
Okay. Now I would like for you to kindly read. There's an orange underlined part of it. That one sentence, if you don't mind.
Studies of the natural history of many TMDs suggest that they tend to improve or resolve over time.
how would you react to that statement from AADR?
I would disagree with that. And all I could say is that the treatment that I have received has helped me tremendously.
Right.
And I truly feel like if I have not had this treatment, I would still be experiencing the pain and
So
symptoms
you didn't
I was
notice it
having.
getting better on its own over the 10-year
It
period?
was not.
Okay.
Oh, no.
Okay. But that is what that statement says. That's what I'll ask your opinion. All right. Anything else you want to add?
I don't think so.
All right. Thank you.
Thanks.